Tonight, inshallah, I will speak about the acetabular fracture, evaluation, anatomy, and classification. الاسيتابلم طبعا ده من المواضيع المهمه جدا. We all have to first to understand it. لان مشكله الاسيتابلم ان احنا most of us we do not understand the anatomy and the geometry of the acetabulum. So first I have to understand it before I treat it. The normal anatomy of the acetabulum has columns and walls. This is the anterior column and this is the posterior column. Walls, this is the anterior wall and this is the posterior wall. From the lateral aspect of the pelvis, the innominate osseous structural support of the acetabulum may be classified as two column construct forming inverted Y shape. The anterior column, بنعرف منين الانتيريور column? The anterior column is diagnosed from the iliopiopic or it's the iliopiopic component or the iliopiopic line, extends from the iliac crest to the symphysis pubis and includes the anterior wall of the acetabulum. And the posterior column, which is represented by the ilioischial line or the ilioischial component, extends from the superior gluteal notch to the ischial tuberosity and includes the posterior wall of the acetabulum. The anterior and posterior walls extend from each respective column and form the cup of the acetabulum. The anterior and posterior columns connect to the axial skeleton through a strata of bone, which is called the sciatic petrous. Here we have the anterior column, and here we have the posterior column. This is the anterior wall. This is the posterior wall. This is the sciatic petrous connecting both anterior and posterior columns, and this is the sacroiliac joint. When looking at the acetabulum in face, the anterior and posterior columns have the appearance of a great letter lampada. The anterior column represents the longer, larger portion which extends superiorly from the superior piopic ramus into the iliac wing. This is the anterior column. This is the anterior column, and the posterior column extends superiorly from the ischio-piopic ramus as the ischium toward the ilium. The anterior and posterior columns of the bone unite to support the acetabulum. In turn, the sciatic petrous extends posteriorly from the anterior and posterior columns to become the articular surface of the sacroiliac joint, which attaches the column to the axial skeleton. The anterior and posterior walls, which extend from the columns and support the hip joint, are well seen on axial CT. This is the axial CT. The anterior and posterior walls, which extend from the columns and support the hip joint, well seen here. This is the anterior column, and this is the posterior column. This is the axial CT. And of course, the best way of diagnosis and classification of the acetabular fractures is the CT and the three-dimensional CT. The acetabular dome, the superior weight-bearing portion of the acetabulum at the junction of the anterior and posterior walls. أنا عندي anterior wall, this is the anterior wall, this is the posterior wall, unite to form the dome of the acetabulum. What's the mechanism of injury of the acetabulum? Like pelvic fractures, these injuries are mainly caused by high energy trauma secondary to a motor vehicle accident, motorcycle accident, or fall from a height. I have to understand properly the mechanism of injury. The fracture pattern depends on, number one, the position of the femoral head at the time of injury. Number two, the magnitude of force. And number three, the age of the patient. Mechanism of injury, direct impact to the greater trochanter. If I have a direct impact to the greater trochanter, I have to see the position of the hip. هل الهip ده في neutral position? If the hip is externally rotated position and abducted position, or if the hip is internally rotated position. لو الهip في neutral position هيحصل transverse acetabular fracture. كل ما يبقى الهip abducted hip, it will cause a low transverse fracture, and an adducted hip will cause a high transverse fracture. If the hip is externally rotated and abducted, it will cause anterior column injury. And if the hip is internally rotated, it will cause a posterior column injury. with indirect trauma زي الداشبورد injury to the flexed knee. كل ما as the degree of hip flexion increases, the posterior wall is fractured in an increasingly inferior position. بالتالي as the degree of hip flexion decreases, the superior portion of the posterior wall is more likely to be involved. So the type of and the geometry of fracture depends mainly on the position of the hip at the time of trauma. Clinical evaluation, I have to evaluate the trauma evaluation with attention to the ABC, airway, bleeding, and circulation. Patient factors, I have to check the patient factors, such like the age, the degree of trauma. Is there any associated injuries? Of course, I have to examine other joints, general medical conditions, neurovascular status, sciatic nerve injury, which is a very high instance to be injured, especially في posterior column disruptions, up to 40%, femoral nerve involvement with anterior column injuries. The presence of associated ipsilateral injuries with particular attention to the ipsilateral knee, of course. If dashboard, I have to check the knee and the soft tissue injuries. نيجي بقى للكلام المهم, the radiological evaluation. How to evaluate a fracture acetabulum. I have 5 pelvic x-rays. The anteroposterior view, the 2 Jodette views, the obturator and iliac, the iliac and obturator oblique views, 2 inlet and outlet views, inlet and outlet pelvis x-rays, and of course, I have the CT. This is the inlet view. This is the outlet view and the obturator and iliac oblique view. The anatomical landmarks in anteroposterior view. I have to be oriented with the landmarks in the X-ray, so I can properly diagnose the type of fracture. What are the landmarks? It's very important. Number 1, the iliopectineal line of the anterior column. Number 1, the iliopectineal line of the anterior column. Number 2, the ilioischial line of the posterior column. This is the iliopectineal line representing the anterior column. This is the ilioischial line, the green line, representing the posterior column. This is the anterior lip of the anterior wall, and this is the posterior lip, and the line that depicting the superior weight-bearing surface terminating as the medial teardrop. The teardrop is very important. نشوفهم على bone. This is the iliopectineal line. This is the ilioischial line. This is the anterior lip or anterior wall. This is the posterior lip or the posterior wall, and of course the teardrop is here. Of course, again on the X-rays, iliopectineal line, ilioischial line, anterior lip, posterior lip or posterior wall. The teardrop is very, very important item. The teardrop has 2 limbs, the internal limb of the teardrop, the internal limb, and the external limb. The internal limb is the outer wall of the obturator canal. This is the obturator canal. The outer wall is the internal limb. The external limb represents the middle 1/3 of the cotyloid fossa, and the inferior border is the ischiopiopic notch. Now we will start to speak about the different views. I have number 1, the iliac oblique radiograph. How to do the iliac oblique view? The iliac oblique view is done. بعمل ايه? I have to elevate, rotate the patient 45 degrees. The 45 degrees, it's called 45 degrees external rotation view, taken by rotating the patient into 45 degrees of external rotation. How? By elevating the normal, the sound side on a wedge. يبقى الإلياك oblique view أنا برفع النورمال سايد مش الأفكتد سايد، برفع النورمال سايد، وده اللي بنسميه الاكسترنال روتيشن فيو by elevating the uninjured side on a wedge. This best demonstrates the posterior column اللي هو represented بالilioischial line, the iliac wing, and the anterior lip, the anterior wall of the acetabulum. The iliac oblique view. Number 1, the border of the sciatic notch. ده اللي أنا بشوفه فيها. Number 2, the anterior wall or anterior lip. Number 3, the posterior column represented by the ilioischial line. Number 4, the iliac wing, and sometimes the posterior wall. This is the view in plane radiograph. Obturator oblique radiograph. اتكلمنا دلوقتي على الإيلياك. طيب امال الاوبتيوريتور oblique radiograph, it's 45 degree internal rotation view. The first iliac oblique view, it was the 45 degree external rotation view. Now this is the 45 degree internal rotation view. This is best for evaluating the anterior column and the posterior wall or the posterior lip of the acetabulum. Sorry. It's taken by elevating the affected hip 45 degrees to the horizontal by means of a wedge, and directing the beam through the hip joint with a 15 degree upward cephalic tilt. This is the obturator oblique view. بشوف فيها iliopectineal line of the anterior column. This is the iliopectineal line. بشوف posterior wall, posterior lip. This is the posterior wall or the posterior lip. بشوف anterior half of the joint وبشوف iliac wing profile, which is called the spur sign, the spur sign site. واحنا هنتكلم على spur sign ده لانه very important sign. هنتكلم عنه in details. This is the obturator oblique radiograph. The inlet and outlet X-rays. Inlet views ان انا ببقى directing the beam from cephalid about 45 to 60 degrees, and this is what can I see in it, and this is the inlet view, and this is the outlet directing the beam at 45 to 60 degrees, and this is what can I see, and it's mainly used for diagnosis any symphysial disruption. This is the outlet view. Now we will talk about the CT scan, which is very important in diagnosis. The CT scan provides additional information regarding the size and the position of the column fractures, any impacted fractures of the acetabular wall, any retained bone fragments in the joint. طبعا دي مش هنقدر نشوفها الا في CT. The degree of comminution and the sacroiliac joint disruption. بستعمل ال 2 and 3 dimensional CT scans are useful in evaluating intra-articular fragments as well as specific morphological characteristics of any given fracture pattern. This is the CT. Before a 3-dimensional CT scan is ordered, the fracture pattern I have to assemble it, should be drawn in a 3-dimensional model of the pelvis to compare the 3-dimensional reconstruction. How you are going to reconstruct this type of fracture. 3-dimensional reconstruction allows for digital subtraction. مهم قوي ان انا اعمل digital subtraction of the head، وفي طبعا اجهزه كتير بتعمل digital subtraction of the head، بالتالي هيديني full delineation للacetabular surface. This is an example of CT cuts through the acetabulum. This is an example of both column fracture. هنتكلم لسه على الكلاسيفيكيشن. نيجي بقى للموضوع المهم. يبقى قبل ما نبدا نتكلم على الكلاسيفيكيشن الاول لازم نعرف how to diagnose. اول حاجه we have to understand the anatomy. Number 2, we have to understand the X-ray and CT morphology so we can be able to understand the classification of the acetabulum. بالنسبة ل most of us, the acetabular fracture is a very, very sophisticated and very difficult fracture to understand. But if you understand the anatomy and the radiological anatomy, you will easily understand the classification of the acetabular fracture. Accurate classification of acetabular fractures is very important to determine the proper surgical treatment. And أنا لازم I have to understand the classification and the acetabular fracture, so which approach will be used. يعني أنا هدخل إزاي؟ ما ينفعش إن أنا ما أبقاش فاهم الكلاسيفيكيشن وأدخل أعمل fixation. You'll go anteriorly, posteriorly, extensile approach. So you have to understand the anatomy and the classification. Although radiographic examination provides essential information for acetabular fracture, CT, including multiplanar reconstruction, is very helpful in visualization of the complex fracture. أشهر classification, the most famous classification of acetabular fractures. هو في many classifications of acetabular fracture, but the most common and the most commonly used is the Jaudet-Letourneau fracture. Because of the complex acetabular anatomy, various classification schemes have been suggested, but still the Jaudet-Letourneau classification system remains the most widely accepted. This classification system subdivides the acetabular fracture into two main types: the elementary fracture types and the associated fracture types. The elementary fracture types: posterior wall, posterior column, anterior wall, anterior column, and transverse. And for the associated fracture types: T-shaped, posterior column and wall, anterior wall or column with posterior hemitransverse, and very important fracture which is the both column fracture. هنتكلم عليهم in details واحد واحد. This is the Jaudet-Letourneau classification. The elementary fracture types: the posterior wall, the posterior column, the anterior wall, the anterior column, and the transverse fracture. This is the elementary. هنجيبهم في كذا صورة بحيث نبقى فاهمينهم وعارفين how to diagnose them. This is the posterior wall. This is the posterior column. This is the anterior wall. This is the anterior column. هنعرف طبعا the differences between each one of them. And this is the transverse fracture. For the associated fractures, this is the posterior wall, and posterior column. This is the posterior wall with posterior column. Transverse with posterior wall. This is the T-shaped fracture. This is the anterior with posterior hemitransverse. And this is the both column fracture. And now we will know how to diagnose each one of these. These are the elementary types. Again, the posterior wall. Again, the posterior wall, the posterior column, the anterior wall, the anterior column, and the transverse. هنعرف how to differentiate between each one of these. Frequency of acetabular fractures. For the elementary fractures, the posterior wall is the most common. It represents 27%, 27%, and the transverse about 9%, the anterior column 5%, the posterior column 4%, and the anterior wall 2%. Associated fractures: transverse and posterior wall 20%, both column 90%, T-shaped 6%, anterior wall and posterior hemitransverse 5%, and posterior column and posterior wall 3%. يبقى احنا من اللي شايفينه ان the most common fractures is the posterior wall, the transverse and posterior wall, and both column fractures. These are the most encountered type of fractures. The posterior wall fractures. For the posterior wall fractures, the isolated posterior wall fracture is one of the most common types of acetabular fracture, prevalence about 27%. The ischium is disrupted. The fracture line originates at the greater sciatic notch and travels across the retroacetabular surface and exits at the obturator foramen. The ischio-pubic ramus is fractured. The posterior wall fractures, an isolated posterior wall fracture does not have a complete transverse acetabular component. بالتالي iliopectineal line, the iliopectineal line is not disrupted. You have to know this quite well. The iliopectineal line is not disrupted, which excludes classification of transverse with posterior wall. يبقى في posterior wall only, isolated posterior wall, the iliopectineal line is maintained. However, disruption of the ilioischial line may or may not be present as an extension of the comminuted posterior wall fracture. I have to diagnose it by oblique radiographs, and CT are helpful in showing the isolated posterior wall fracture. This is the CT showing the isolated posterior wall fracture. For the posterior column fracture, the posterior wall and posterior column fractures, how can I distinguish between them? In the posterior column fracture, the ilioischial line is interrupted. في posterior column fracture, the ilioischial line is interrupted. In a posterior wall fracture, only the retroacetabular surface is disrupted and the ilioischial line is maintained. This is the posterior column fracture. Anterior wall and anterior column fracture. For the anterior wall and anterior column fractures, how can I differentiate between them? Can be distinguished by the additional break in the ischiopiopic segment of the pelvis, which present in the anterior column fracture. This is the anterior wall, and this is the anterior column. You see the difference? This is the just anterior wall, and this is the anterior column. The ischiopiopic segment is interrupted here. For the transverse fracture is a very important fracture. A transverse acetabular fracture involves a fracture line that goes through both columns of the acetabulum. But a portion of the dome of the acetabulum remains attached to the constant fragment of the iliac wing. This is the transverse involving both columns, but still there is a portion attached to the iliac wing. This is the transverse fracture in obturator and iliac oblique view. The transverse fracture has three main types. The types of the transverse fracture depending on the orientation of the fracture line relative to the dome, or it's called the tectum of the acetabulum. I have three main types: the transtectal, the juxtatectal, and the infratectal. The transtectal through the acetabular dome, the juxtatectal through the junction of the acetabular dome with the fossa acetabuli, and the infratectal through the fossa acetabuli. Transtectal fractures, they are very important, they are less forgiving, must be reduced anatomically, whereas infratectal are low, maybe low enough, can be treated without surgery depending on the pattern. The femoral head follows the inferior ischiopiopic fragment and may dislocate centrally with the transverse fracture. These are the type. احنا قلنا في عندنا the transtectal type, the juxtatectal type, and the infratectal type. The transverse fracture are sagittal plane. This is a very important statement. The transverse fractures are sagittal plane fractures, whereas both column fractures are coronal plane fractures. مهم قوي دي. Transverse fractures sagittal plane. Both column fractures coronal plane. ازاي؟ نشوف. The coronal plane fractures, number A, this is the coronal plane fracture of one or both columns, and this is the sagittal plane fracture, which is the transverse fracture. So the transverse fracture are sagittal plane fracture, whereas the both column fractures are coronal plane fractures. This is a CT cut of the transverse fracture, the sagittal plane. This is the transverse fracture in the sagittal plane. Now we will speak about the associated types. احنا قلنا associated types. I have the posterior wall and posterior column, posterior wall and posterior column, transverse with posterior wall or column, T-shaped fracture, anterior column or anterior wall with posterior hemitransverse, and the very important and very complicated and very sophisticated type, the both column fractures. This is the types that we have mentioned. Posterior column and posterior wall. This is the first one. The posterior column and the posterior wall as diagnosed on oblique radiographs. Very important is the T-shaped fracture. The T-shaped fracture, this is the T-shaped fracture. How can I distinguish between the T-shaped fracture and the transverse fracture? Now, on the transverse fracture, whether it is juxtatectal, infratectal, types of it, how can I differentiate between it and the T-shaped fracture? The T-shaped fracture is transverse fracture of any type, any of the three types of the transverse fracture, plus vertical fracture through the ischiopiopic fragment. يبقى الجزء ده just only this differentiate between the transverse fracture and the T-shaped fracture. The T-shaped fracture is a transverse fracture of any of the three types plus vertical fracture through the ischiopiopic segment. The vertical component is best seen on the obturator oblique view. The T-shaped fracture is similar to both column fracture as it disrupts the obturator ring, and another similarity that it disrupts the iliopectineal and ilioischial line. يعني هو واخد معايا both anterior column and posterior column. So how can I differentiate also between T-shaped fracture and the both column fracture? The superior extension of the fracture does not involve the iliac wing. This is a very important item, which allows differentiation from both column fracture, and we will see it at once. This is the T-shaped fracture. The transverse fracture line is not actually in the anatomical transverse plane, but rather it is transverse relative to the acetabulum. كلنا عارفين الاستابلم ان ليه orientation وليه inclination because the cup shape of the acetabulum is normally tilted inferiorly and anteriorly. The inclination and the anteversion of the acetabulum, the transverse fracture plane assumes a similar orientation with the acetabulum. يعني هو واخد نفس orientation, inclination and the anteversion of the acetabulum. Therefore, on radiographs, the fracture lines that disrupt the iliopectineal and ilioischial lines course superiorly and medially in an oblique plane following the orientation of the acetabulum. T-shaped fractures differ from transverse fractures by the additional fracture line. احنا قلنا الكلام ده that runs through the quadrilateral surface. As a result, the anterior column and posterior column are separated by fracture lines. This becomes very important when choosing why I should know the classification so I can properly manage. This becomes very important when choosing the surgical approach اللي أخونا الدكتور سعد هيكلمنا عنها إن شاء الله, the surgical approach to the acetabulum. In a pure transverse fracture, the anterior and posterior columns may be reduced through single approach. Transverse fracture, I can, through a single approach, reduce one column and the other column will follow in the reduction. Once the anterior column has been reduced, the posterior column will follow the reduction and can be palpated indirectly. In a T-shaped fracture, the two columns must be reduced independently. They are separated. I have to reduce each one. This becomes extremely important when choosing a surgical approach. It's important to recognize the difference between the transverse and the T-shaped fractures. Transverse fracture, just one approach. The T-shaped fractures, I may use two approaches. This is the T-type fracture in CT. We can notice in this CT, the T-shaped fracture or T-type fracture, the anterior and posterior columns are dissociated. The transverse fracture and posterior wall fracture. The transverse fracture plus comminuted posterior wall fracture, which is usually displaced, the iliopectineal and ischiopectineal line are disrupted. Both lines are disrupted. The obturator oblique view best demonstrates the position of the transverse component with a posterior wall element. The anterior column and posterior hemi-transverse. This is an example in X-ray. Now we come to a very, very important item, which is the bicolumn fracture or both column fracture, which was formerly called the central acetabular fracture. Both columns are separated from each other and from the axial skeleton, resulting in what's called floating acetabula. This is the most complex type. A both column fracture can be easily considered a high T-shaped fracture and can be easily differentiated from the T-shaped fracture by the proximal extension. High T-shaped fracture where both columns have been separated from the sciatic papyrus. The spur sign. Now we come to a very important sign in both column fracture, which is called the spur sign. The spur sign best seen on obturator oblique view. This is pathognomonic for both column fracture. This sign represents posterior displacement of the sciatic papyrus. Now, on a sciatic buttress, both anterior and posterior columns meet at the sciatic buttress. This sign represents posterior displacement of the sciatic buttress of the iliac wing fracture, which essentially disconnects the roof of the acetabulum from the axial skeleton. When this occurs, weight from the torso and upper body can no longer be supported by the acetabulum. This is the spur sign. On radiograph and CT, the spur sign appears as a sharp shard of bone or sharp edge of bone extending posteriorly at the level of the superior acetabulum. This is the spur sign. Evaluation of sequential CT images shows the fracture, which separates the sciatic buttress from the acetabular roof. This is the spur sign in a bicolumn fracture of a 35-year-old man. This is the example in 3-dimensional CT. يبقى احنا كده خلصنا الclassification of the acetabulum. Now I have to come to the management of the acetabulum. I will speak in a very short brief about the approach of the acetabulum. Professor Saad Sholah will speak in details about the acetabular and hip approaches. The approaches of the acetabulum are either posterior, Kocher-Langenbeck, or anterior, ilioinguinal and modified stoppa, and extensile, extended iliofemoral. The Kocher-Langenbeck indications posterior wall fractures, posterior column fractures, posterior column and posterior wall fractures, juxtatectal and infratectal transverse or transverse with posterior wall fracture, and some T-type fracture. هنتكلم عليها بسرعه لان دكتور سعد will speak about in details about it. The ilioinguinal approach, the anterior approaches. The ilioinguinal approach, the indications is the anterior wall and anterior column fracture, transverse with significant anterior displacement, anterior column plus posterior hemitransverse, and in both column fracture. This is the ilioinguinal one. We will pass it. And this is the fixation of the anterior column. The extended iliofemoral approach, it's used in T-type fracture, transtectal transverse fractures, delayed reconstruction, and this is extensile extended iliofemoral approach. The intraoperative assessment of reduction is very important. How can you assess the reduction of the acetabular fracture intraoperatively? Number one, by visual assessment. أشوفه بعينيا, visual assessment of the fracture reduction, or I palpate it, palpation of the fracture in the quadrilateral surface through the greater sciatic notch and the anterior column, C-arm assessment, plain X-ray, and you have to assure that all screws are out of the joint. Take-home message and conclusions. The good understanding of acetabular fracture is very important in the management. You have to know the anatomy, optimize one surgical approach. كل ما أقلل الابروتشز كل ما كان أحسن. I have to optimize the goal of perfect reduction. And now we come to the end. Thank you so much.